Hello everyone. Today we will discuss and learn about an important topic, and maybe this is the last topic from my side to you. Okay, now. So we'll be learning about the blood supply of the brain. So in my previous class actually we discussed about the blood supply of the spinal cord, right? So, and even along with the brainstem classes like medulla, pons, and midbrain, you even learned about the blood supply of those respective regions. So, what is left is the cerebral hemispheres and the nuclei within the cerebral hemispheres and few of those ventricles and all. So, okay. So, the brain is supplied by two sets of we can say the vascular system or vessel systems. So you can see in this picture, so all these blood vessels supplying the brain. So I said two vessel systems, so one on the anterior side and one on the posterior side. So that's why they are even called as anterior system and well as the posterior system. So these two systems are, so one set of blood vessels, that is from the internal carotid arteries, both sides, right and left. So that is called as the carotid system or the internal carotid artery system. And then from the posterior side, the two vertebral arteries, these two vertebral arteries enter through the foramen magnum and unite to form the basilar artery, so which will also be supplying the brain along with your the cerebellum and even the brainstem part. So this system of vessels we call it as vertebro-basilar system. So these are the two systems of vessels which will be supplying the brain. So I repeat, anteriorly you have carotid system, then posteriorly you have the vertebro-basilar system of vessels. So let's see how exactly these two systems of vessels supply the brain. Okay. So this is the one picture I brought to just show you what are the areas of territories of these vascular systems, what I explained as the carotid system and then the vertebro-basilar system. So roughly if you draw an oblique line which passes through your, this is the lateral sulcus, you already know that, right? So this is the lateral sulcus. If you draw a line through the posterior ramus of the lateral sulcus and passes through your the parietal lobe. So now the part of the brain anterior to this line is supplied by the carotid system of vessels, so which is roughly about 80% of the brain. Okay, and the part which is posterior to this line, so this, so along with your even the cerebellum and then the brainstem is supplied by your vertebro-basilar system of vessels, so roughly about 20% we can say. So mainly when I said 80%, 20%, it's relates to your what is that cerebral hemispheres. So the 80% of the brain is by the carotid vessels, whereas 20% is by your vertebro-basilar vessels. Okay. So now on to the next slide. So as I was explaining the same, so this is what is the vertebro-basilar system of vessels through different branches. So these two vertebral arteries, they enter. You all know the even the beginning of these, they are the branches from your subclavian artery. They run vertically upwards within the foramen transverse area of the cervical vertebrae, and finally they pass through the dura mater, enter the, that is your foramen magnum, and lie in the subarachnoid space at the base of the brain. So where they will be taking part in the formation of a circle of Willis. What is that circle of Willis is? This is the circle anastomotic what is it vessel system, which is formed by both these systems, that is vertebro-basilar system as well as the carotid arteries. So these are the two carotid arteries which are here, which are entered into the cranial cavity by passing through, you know that you've already studied the base of the skull. So just anterior to the jugular foramens, you have those carotid canals, that is the lower opening of the carotid canal. So both these carotid arteries, the right and left side, they enter the cranial cavity through that carotid canals and enter into the cranial cavity by passing to the posterior part of your foramen lacerum and then into the cranial cavity. I will come to that when you go to that internal carotid artery. So what I was explaining is these two vascular systems, the carotid as well as the vertebrobasilar vessels, so they will be making the circle of vessels that we call it as circle of Willis. The name is coined on the person who what is the describe this arterial circle. Okay, so first let's begin with these vertebral arteries. As I said, they begin from the subclavian artery, run through the foramen transversum of the cervical vertebra, and then pass through the foramen magnum, pierce through the dura, and then at the lower border of the pons. See here, this is the medulla, this is the pons, and this is the upper part is the, what is that? The midbrain part. So at the junction of, you can say, the pons and the medulla or the lower border of the pons, so both these vessels, the right and left vertebral arteries, they unite just posterior to your basilar part of your, what is the occipital bone, or even what we call it the clivus of the sphenoid bone. So just posterior to that, they both these vessels, the right and left vertebral arteries, they unite to form a single vessel that is called as the basilar artery. So this basilar artery runs the basilar groove on the anterior side of your pons. Okay. So then at the upper border of the pons or junction between midbrain and pons, this divides into two terminal branches, that is the two posterior cerebral arteries. So that is the formation of the basilar artery at the lower border of the pons by the union of the two vertebral arteries. So that is the basilar artery formation, and it terminates by its two terminal branches, that is the two posterior cerebral artery. This is the right posterior cerebral and this is the left posterior cerebral artery. Let me, yeah. So this is the right posterior cerebral artery and this is the left posterior cerebral artery. That's how the basilar artery ends. So this is the just in brief about the vertebral system of vessels. I will come to this circle of Willis again or in detail about this vertebral system in the coming slides. So next move to yeah, 1 minute. The internal carotid arteries. So as I was explaining, so this is the picture showing you the entry of the internal carotid artery into the cranial cavity by passing through this carotid canal. So it runs through the carotid canal. This is the lower opening, this is the upper opening. It runs through the carotid canal, and in the middle cranial fossa, it runs through the cavernous sinus. Very important, very, very important. So as already discussed, I think learnt about the cavernous sinus. There you might have learnt the internal carotid artery passes through the cavernous sinus and pierces the dural roof of the cavernous sinus, and then there it divides into two important terminal branches, that is one is the middle cerebral artery and the other is the anterior cerebral artery. So these are the two terminal branches. This is, you can see the termination. So the internal carotid artery running through the carotid canal, running through the cavernous sinus. So here he is having this, what we, the course is explained as the sinus course. So the S-shaped course of your the internal carotid artery, the sinus course of the internal carotid artery. So this is the only vessel. The internal carotid artery is the only artery, you can say, which runs within the vein. So if you consider the cavernous sinus as a vein, so this artery runs within the vein. So it is the only region where artery is running through the vein. So you will not find such what is the course of the artery anywhere in the body. So it has a sinus course, passes through the cavernous sinus, pierces through the dural roof of the cavernous sinus and ends by terminating into middle cerebral artery and then the anterior cerebral artery. So this is in brief about this carotid vessel system as well as the vertebrobasilar system. So now these two, what is that? vascular systems, as I said, they make an anastomotic arterial circle at the base of the brain, so that we call that as the circle of Willis. So before going into the details of this vertebral artery, the basilar artery and even the carotid artery, their branches and all, so let me show you a picture where you should be so knowing a brief idea about the base of the brain, so which you already studied. So just to refresh your mind and explaining. So this is what is called the midbrain, and these are the two cerebral peduncles, the right and then the left cerebral peduncles. And this is what is the optic chiasma. Hope you are following. So this is the optic chiasma, and this is the optic nerves, and this is the optic tract, and this is the olfactory nerves. Okay, this is the olfactory nerves. So this is the optic chiasma, optic nerves, and optic tract, and this is the pituitary stalk, and this is what is the interpeduncular fossa. So which even explained when the I was explaining in the midbrain, ventral side of the midbrain. So these are the two mammillary bodies, and this is the area which is highly perforated. This we call it as the posterior perforated substance. Very important. So because when I will be explaining the vessels, the branches of the circle of Willis, so I'll be explaining like they pass through the posterior perforated substance, anterior perforated substance. So that's why you should have knowledge about these parts of the brain so that you will understand those what are the branches. So this is the posterior perforated substance in the interpeduncular fossa. So now you observe here, this is what we call it as the anterior perforated substance. What is this? Anterior perforated substance. So now the carotid arteries, both the carotid arteries, they will be just lateral to your this same optic chiasma. Optic chiasma. Okay. So I repeat, optic chiasma, optic nerves, and this is the optic tracts. These are two cerebral peduncles. This is the interpeduncular fossa where you have this pituitary stalk, the mammillary bodies, and the posterior perforated substance. And the area lateral to this optic chiasma is what we call it as the anterior perforated substance. So the anterior perforated substance, and this is the posterior perforated substance. Okay, yeah. So now let's move again to your the circle of Willis. Yeah. So let me go to the picture. So this is again. I will come back. Okay. So it's a beautiful picture from your Netter Atlas to show all the vessels which supply the brain. Okay, so these are the two vertebral arteries, so they are passing through the foramen magnum. Okay, you can see here both these vessels, the vertebral arteries, uniting at the lower border of the pons to form the basilar artery. So let's look into the branches of this vertebral artery. The first branch from the vertebral artery after passing through the foramen magnum is your what is that? Posterior spinal arteries. What are they? The posterior spinal arteries. So these posterior spinal arteries, so usually actually they are from the posterior inferior cerebellar artery, or maybe sometimes they may be arising from the vertebral arteries. So that's why when they arise from the vertebral artery, so we say the posterior spinal artery as the first branch. If not, if it is arising from the posterior inferior cerebral artery, so then the first branch of the vertebral artery after entering into the posterior cranial fossa is the posterior inferior cerebellar artery. So don't confuse between cerebellar and cerebral. So first branch is the posterior inferior cerebellar artery. If the posterior spinal is not arising from vertebral, otherwise the posterior spinal will be the first if it is arising from the same, that is vertebral artery. Okay, so both, so the right as well as left vertebral artery give two, what is that, posterior spinal artery which runs down. So already explained about the posterior spinal artery as well as the anterior spinal artery in the class with that is the spinal cord, blood supply of the spinal cord. So they run on the posterior side of your the spinal cord and then supply the spinal cord, the posterior part of the spinal cord. So now this posterior inferior cerebellar artery, it runs posteriorly. As the name only indicates, it supplies part of your medulla oblongata and as well as the posterior part of the inferior surface of your, you can see it here. So this is the posterior inferior cerebellar artery going to the cerebellum, the inferior aspect of the cerebellum, the posterior side. Okay, so that is the area of supply of this, the first branch, that is the posterior inferior cerebellar artery. So it even supplies your the medulla oblongata. Okay, so when you move further, so you have two more branches, both from, that is right as well as left vertebral artery. So that is the anterior spinal artery. Soon after their origin, they unite to form a single anterior spinal artery which runs the anterior side of the spinal cord, supplying the anterior part of the spinal cord. You know that. So that is again reinforced by the segmental vessels. So which I already explained along with the spinal cord. Okay. So this is they are the second, or what we say, the third branches, that is the anterior spinal artery. So now this is the after its formation of your, what is the basilar artery, you have branches from this basilar artery. The first branch from this basilar artery is the anterior inferior cerebellar artery. What is that? Anterior inferior cerebellar artery. You can see it here. So this is what is the anterior inferior cerebellar artery, anterior inferior cerebellar artery. So which will be again supplying the inferior surface of the cerebellum, so which passes anterior to the flocculus of the cerebellum, supplying the anterior part of the inferior surface of the cerebellum. Even part of it is even supplying the lower part of the pons as well as the medulla oblongata. So that is the anterior inferior cerebellar artery. So this is the one anterior inferior cerebellar artery. Please, what is that? Follow this cursor. So this is the anterior inferior cerebellar artery. So along with the anterior inferior cerebellar artery, sometimes you find a vessel which may be again arising directly from the basilar artery, or it may be a branch from anterior inferior cerebellar artery. It is a very important artery that we call it as the labyrinthine artery. What is this? This is the labyrinthine artery. So where you can see it here. This is the labyrinthine artery, are also called as the artery of the inner ear. So which runs along with the eighth cranial nerve, that is your vestibulocochlear nerve, runs along with the vestibulocochlear nerve, runs through the inner ear and supplies the labyrinth of the inner ear, including the facial nerve. Got it? So this is the one more branch of this basilar artery. Okay, so now as it runs upwards on the what is the basilar groove on the what is that, pons, so it gives multiple branches on either side. So they are called as the pontine branches, which will be supplying the pons. So at the upper border of the pons, it gives a one more branch. So before dividing it into posterior cerebral, so that is the branch what we call it as superior cerebellar artery. What is that? Superior cerebellar artery. You can see it here. This is the superior cerebellar artery, which supplies the superior surface of the cerebellum. Superior surface of the cerebellum. So the name only indicates. So three arteries concerned with cerebellum: superior cerebellar artery, anterior inferior cerebellar artery, posterior inferior cerebellar artery. Okay. So these are all the branches from this vertebro-basilar system of vessels. So that is, first branch is posterior spinal, or even maybe posterior inferior cerebellar artery. So then you have anterior spinal arteries, then you have anterior inferior cerebellar artery, then you have the labyrinthine vessels, then the pontine vessels, then you have superior cerebellar artery. So after that, so as I said in the beginning, it ends by dividing into two posterior cerebral artery. It is cerebral. It is cerebral, concerned with the cerebral hemisphere. So which mainly supplies the inferior surface of the cerebral hemisphere. So this is what is the posterior cerebral artery. So which are the terminal branches of this basilar artery. So now you see a very important relation. So here you have the exit of this, the third nerve. What is this nerve? This is the oculomotor nerve, emerging between the posterior cerebral and the superior cerebellar artery. Very important. Okay, so that's why any aneurysms in these vessels, if they burst, so they will be causing damage to this nerve. So we'll come to that at the maybe at the end of the lecture, the clinical aspects and all. So that is the terminal branches of the basilar artery. So I will go back to this line diagram which I was explaining the same thing. So you have these vertebral arteries. So where you have this posterior spinal artery. So then you have the posterior inferior cerebellar artery, then you have anterior spinal artery, then you have anterior inferior cerebellar artery, then you have the labyrinthine artery, so then you have the pontine branches, and then you have superior cerebellar artery and the two terminal branches of the posterior cerebral artery. Okay, so now come to the internal carotid artery, which I already explained. So it runs through the carotid canal, passes through the posterior part of foramen lacerum, runs through the cavernous sinus. The course here is sinus course. So runs through the cavernous sinus and pierces the dural roof of the cavernous sinus and ends by terminating into. I will go back to the again. Yeah. So this is the cut end of the internal carotid artery. Here the internal carotid artery is cut and you can see the branches of the internal carotid, so which are two little bigger vessels, that is the middle cerebral artery and it's the one anterior cerebral artery. So along with these two terminal branches, it even gives few of the branches which are labeled here. So you can see it here. This is the one more important artery, that is the anterior choroidal artery. Anterior choroidal artery, and even you may find one of the branch that is which communicates with the posterior cerebral artery, that is the posterior communicating artery. What is that? Posterior communicating artery. So what are the two terminal branches of the internal carotid? It is the anterior cerebral and a bigger middle cerebral. You can say the internal carotid artery continues as middle cerebral, because when you compare the caliber of anterior cerebral and middle cerebral, the middle cerebral artery is bigger compared to the anterior cerebral artery. So you can say the internal carotid artery continues as middle cerebral. Before continuing, it gives branches which are the anterior cerebral, anterior choroidal and posterior communicating artery. Okay. So that is the story about the internal carotid artery. So now we go back to again this line diagram. Yeah. So this is the cut end of the internal carotid artery. So you can see the branches. So this is the anterior choroidal artery, which is the main branch supplied to your choroidal plexus of mainly your the lateral ventricle. Okay, which is there in the inferior horn of the lateral ventricle. So you know that choroid plexus, which are important. Why? Because they will be secreting your the cerebrospinal fluid, the CSF, within the ventricle. So CSF is secreted by the choroid plexus. How are these choroid plexus formed? This is the choroid plexus is nothing but the plexus of vessels covered by the ependyma, or what is that, the pia mater. So that vessel which forms your this choroid plexus in the lateral ventricle is your anterior choroidal artery, which is a branch from the internal carotid artery. Okay. So that is internal anterior choroidal artery, and this is what is the posterior communicating artery. So which communicates with the posterior cerebral artery. So that is a anastomosis between the carotid vessels as well as the basilar artery branch, that is posterior cerebral artery. Okay, so this is the one anastomosis between the two system of vessels. So now these two anterior cerebral artery, they run anteriorly within the median fissure separating your two cerebral hemispheres and runs up over the corpus callosum and supply much of your the medial surface of your cerebral hemispheres. So now as these two anterior cerebral arteries, they are running anteriorly, so they come closer as they run forward. So these two anterior cerebral arteries are again connected by a vessel that is called as anterior communicating artery. Anterior communicating artery, which communicates both anterior cerebral arteries. So that's how the circle is completed. So this circle of arteries, so is called as circle of Willis. So how this circle is formed? It is formed by the both systems, that is carotid as well as vertebrobasilar system. So posterior cerebral arteries of the basilar artery are connected to the carotid artery by the posterior communicating artery. Very important communication between the carotid system of vessels as well as the vertebrobasilar. So why there is anastomosis between these two systems? If there is any blockage or obstruction in any of these bigger vessels, so that is compensated by a bypass route of the blood through these communications. Okay, so that is the importance of anastomosis. When I am explaining this anastomosis, one more thing I want to stress on here. So there is anastomosis of these arteries when they are at the bigger level. So these bigger arteries only they anastomose. So once the smaller branches arise from these all vessels which enter the nervous tissue, they are end arteries. Very important. So that's why, so any accidents involved in these smaller vessels, these are all smaller vessels. So the nervous tissue is undergo ischemia or bleeding whenever there is any rupture of the vessel. So that part of the nervous tissue which is supplied with these smaller vessels, they suffer. So, and then there will be functional deficit because there is no anastomosis between these smaller branches. So there is anastomosis only at the higher in the tree of this branching pattern. Okay, so only these bigger vessels they anastomose, whereas the smaller branches which actually supply your the brain, so they are end arteries. I will come to that. Okay, so this is the picture explaining you the formation of the circle of Willis and the branches from these two system of vessels. So from the vertebrobasilar system you have posterior spinal, anterior spinal, posterior inferior cerebellar, then you have anterior inferior cerebellar, labyrinthine artery, small pontine branches, anterior inferior cerebellar artery. So all these vessels, so they are concerned with the brainstem and the cerebellum as well as the spinal cord. Okay, so now the two terminal branches of the basilar artery is the posterior cerebral artery, which is be supplying the cerebral hemisphere. Okay, so now these two posterior cerebral arteries are connected to the internal carotid artery through posterior communicating artery. So the other branches from the internal carotid artery are anterior cerebral and then middle cerebral arteries. So the two anterior cerebral arteries are communicated by an anterior communicating artery. That's how this hexagonal shape, six-sided hexagonal shape is shape of what is that arterial circle is completed. So that's why this circle of arteries is also called as the circle of Willis, as I explained, because of the name of the person, that is Willis. Okay, yeah. So this is about the circle of, where exactly is the circle of Willis? It is there at the base of the brain. It is at the base of the brain. So this is the picture of the formation of your circle of Willis. So that is vertebrobasilar system of vessels and even the carotid vessels. So you can see the course of this anterior cerebral arteries running forwards within this median fissure. As they run forwards, you can see they are running upwards. They are running upwards. You can see the bend here. So this is there upwards above the corpus callosum, supplying much of the superior medial surface of your cerebral hemispheres. Okay, whereas if you see the middle cerebral artery, they run in the lateral sulcus. You can see here the small part of the, you can say the temporal pole is cut to show the lateral sulcus. This middle cerebral artery runs in the lateral sulcus and comes on the lateral surface of the cerebral hemisphere. So this is the vessel which supplies majority of the superior lateral surface of the cerebral hemisphere. What is that? The middle cerebral artery. So superior lateral surface, majority of it is supplied by middle cerebral through its many branches. Okay, and anterior cerebral supplies much of the medial surface, whereas posterior cerebral artery supplying your much of the inferior surface. So you know the anatomy of the cerebral hemispheres. You know you have three main surfaces. Okay, superior lateral surface, medial surface and the inferior surface. So superior lateral surface, which is the main artery, it is the middle cerebral. So medial surface, which is the main artery, it is the anterior cerebral, whereas the inferior surface, it is the posterior cerebral. Okay, so I will just show you a or before that let me explain you few of the other branches you see from these vessels what I explained. Okay, so you can see, I will go back to the line diagram again. Yeah, so you see these smaller branches which are entering directly into the, what is that, the nervous tissue or the brain. So they are called as the anterior medial branches, and this is the anterior lateral branches, posterior medial branches, and then posterior lateral branches. So there, in brief, I can say you. So from these vessels which are forming the circle of Willis, you have what you say, the three types of branches coming. So very important. Okay, three types of branches. Number one is the cortical branches. I will show you a picture. Wait a minute. Yeah. So here I have chosen only the middle cerebral artery to show you the different branches from these bigger vessels. So these are the vessels which we call them as the central arteries, and these are the branches which we call them as the cortical branches. And one more set of branches are there which are called as the choroidal branches. You can see here, as I said, one of the branches, the anterior choroidal artery. Where is anterior choroidal artery? You can see here, these are the choroidal arteries which are supplying the ventricles, or which are forming the choroid plexus which secretes your CSF. So what I mean to explain is, there are three types of branches arising from these cerebral vessels. So number one is the cortical vessels, so which are perpendicular branches from the surface of the brain, from the surface or the cortex region. So they will be supplying much of the cerebral cortex region. So these are all the cortical branches. So as I said, so these branches, they doesn't anastomose, they do not anastomose. So even the central branches also, these central branches are of these vessels, they are mainly supplying your the white matter of the cerebral hemispheres, including the nuclei is present within the cerebral hemispheres. What are the nuclei? You know, the basal ganglia, the thalamus. So all these are supplied by these central branches, which are the branches from these main vessels, either maybe middle cerebral, posterior cerebral, or the anterior cerebral artery. So these are called as the central branches. So the branches which are supplying the corpus striatum or the basal ganglia, they are called as striatal branches. So whereas the branches which supply the thalamus, they are called as thalamic branches. So but mainly they are classified as the central branches, whereas these are the cortical branches which supply your cerebral cortex. And the other set of branches were explained as the choroidal branches, which are again two. So the anterior choroidal mainly from the carotid system of vessels, whereas posterior choroidal vessels which are mainly from your the vertebro-basilar system of vessels. So this choroidal vessel, this is the anterior choroidal artery from the carotid system. So they are mainly forming carotid, what is that, choroid plexus in the lateral ventricle, whereas the posterior choroidal artery from the vertebro-basilar system, so they will be forming the choroid plexus mainly in the third ventricle, from where the again CSF is secreted. So got it. So choroidal arteries are two sets: anterior choroidal, posterior choroidal. Anterior choroidal from carotid, posterior choroidal from the vertebro-basilar. So anterior choroidal, choroid plexus in the lateral ventricle, especially the inferior horn of lateral ventricle, whereas the posterior choroidal vessels, they will be forming choroid plexus in the third ventricle. Got it. So central branches and then the cortical branches. So central branches, I said, they will be supplying the white matter of the cerebral hemispheres, including the nuclei. Depending on which nuclei they are supplying, they are named. So like here you have these striate branches. Okay. So one more important point I stressed about these central and cortical branches is they are end arteries. They do not anastomose. So any small, what is that, rupture or any block and a small emboli from anywhere in the body, it comes and lodges in these vessels. So that part of the brain which is supplied by these vessels, it gets, what is that, infarcted, or what we it goes for ischemia, and then death of that nervous tissue. And we all know the nervous tissue cannot be regenerated, so that goes for necrosis, and you have the functional deficit of that part which is controlled by that nuclei or that fibers, whatever they are there. So you will have the functional deficit. So that's why the study of these cerebral vessels, it becomes very important. So you might have heard very commonly that is your term, that is stroke. So what does the stroke mean? A stroke, so which usually gives rise to your the paralysis, especially seen in the old peoples, okay, who usually suffer from your long term, what is that, hypertension or any ischemic heart diseases. So the clot from the coronary vessels or from anywhere in the body, it gets dislodged, that forms the embola and then comes and lodges there in any of the cerebrovascular and then cause cerebrovascular accident. So what is stroke? It is the cerebrovascular accident. Maybe an infarct or sudden rise in the blood pressure, and these blood vessels may rupture and then cause bleeding and causing the pressure as well as the ischemia of that part which is supplied by that vessel, causing the same functional deficit. So one more point I want to stress on here. So when you compare these cerebral vessels with the extracranial vessels, so I am talking about the intracranial vessels and then the extracranial vessels. So when you look into these vessels which are present within the cranium, so they are very thin. They are very thin compared to extracranial vessels, and even they are little elastic compared to the extracranial vessels. As they are thin, so when you come to the dissection hall and if you dissect the brain and then take out the brain outside, you can't see the vessels, especially the veins, which are very thin, so they are transparent. You cannot make out where the vein is unless it is filled with blood. So it is very difficult to identify the vein unless it is filled with the blood. So thin they are. So if you observe the extracranial any veins or arteries, very easily you can identify the vein or the artery. But here the intracranial vessels, they are very thin. So because of this thinness, they are able to expand, and even that is the reason why they usually go for the rupture with slight increase in blood pressure. Okay, so that's why the cerebrovascular accidents are common because of this what is that structure of these intracranial blood vessels. So they are thin, I guess, maybe because of they are well protected as they are present within the cranium. So maybe that is the reason why they are thin. So that is there the that usually one advantage is they become little elastic so that they can expand and then accommodate the pressure differences. If it exceeds too much, then they will go for rupture. And because of this thinness, so usually even the cerebro vessels, they go for a condition what we call it as aneurysm. So what is aneurysm? Aneurysm is the dilation of the blood vessels. So you can see here, so there will be defect in the tunica media of the blood vessels. So usually, so these dilation of the blood vessels are congenital. So that means, so usually during birth only such dilations of the vessels you find in these cerebral vessels. So very commonly found in the anterior communicating artery. So anterior communicating artery which connects the two anterior cerebral artery, so that vessel is more common, what is that artery which goes for these aneurysm. So that we call it as Berry's aneurysm. What is that called as? Berry's aneurysm. What is aneurysm? It is the dilation of the blood vessels. Okay, so there is no complication unless they go for rupture whenever there is increased pressure. So if they don't rupture, so they will not cause any defect or any problem to the patient. So usually the patients remain asymptomatic. When suddenly one fine day, they rupture, there will be heavy bleeding. So you can see it here in this slide. There is bleeding from this aneurysm sites giving rise to subarachnoidal hemorrhage, giving what is that, raised intracranial pressure, and suddenly the patient collapses and even dies. So accidentally these aneurysms are detected. So whenever you go for the imaging, either CTR, what is that MRI scans, or even if you go for what is that angiogram of these cerebral vessels, so accidentally you may find these aneurysms and you may quickly fix them by doing surgeries. Okay, so if the patient is lucky enough, they may be detected accidentally and then treated for it, preventing their rupture. So this is one more point you should keep in mind: aneurysms and the cerebrovascular accidents, or what we call it as the stroke. So maybe stroke means maybe a bleeding or maybe an infarct. Okay, yeah. So I will come back to the same these three vessels. So I was explaining the areas of the supply of these three important cerebral arteries. So that is anterior cerebral, middle cerebral and the posterior cerebral artery. So this is the superior lateral surface of the brain, okay, where you can see the middle cerebral artery, so running on the lateral side, so supplying your the much of the superior lateral surface of the, what is that, the cerebral hemisphere. Whereas the next slide you can make out, so this is what is the medial surface, so this is what is the anterior cerebral artery which is running upwards over the corpus. This is what is the corpus callosum, right? It runs over the corpus callosum and from it they have multiple branches which supplies your much of the medial surface of your the, what is that, cerebral hemisphere. So there is color decoded pictures are there, so which exactly show the area of supply of these three vessels. I will come to that, okay. So what I mean to say is the important functional areas which are supplied by these vessels. So what functional areas you find in the superior lateral surface? It is your the central what is the sulcus, and anterior and posterior to this central gyrus of the what is sulci are the pre and post central gyrus, where you have sensory and motor area. Even you have the motor speech area, Broca's area, Wernicke's area, auditory area. All these important functional areas, they are supplied by this middle cerebral artery. So any blockage or any thrombus or any clot in these vessels or any rupture of these vessels will cause very serious complications, okay. So this is the middle cerebral artery which is supplying much of these important functional areas, okay. A small strip along the superior border, so involving the same pre and post central gyrus, it is even supplied by your the anterior cerebral artery, so which is even supplying your this much of the medial surface, this paracentral lobule, what is this area around the central sulcus on the medial surface? It is the paracentral lobule, what you say, okay. So which mainly controls your micturition and what is that, defecation center. So that is all supplied by your anterior cerebral artery, including your the frontal lobe and all. It is supplied by the anterior cerebral artery. So now this much of the occipital lobe, both on the lateral surface, medial surface as well as inferior surface, it is by your the posterior cerebral artery, which is belongs to your vertebrobasilar system. As I said, the posterior cerebral is the terminal branch of basilar artery, okay. So what is the area here you find in the occipital lobe? It is your the visual area. It is the visual area which is supplied by your posterior cerebral artery. So you will have the same functional deficits whenever there is any vascular accident involving the posterior cerebral artery. So this is the area of territory of these three important vessels, that is anterior cerebral, middle cerebral and posterior cerebral arteries, okay. So let me show you picture which explains this territory of these three vessels, okay. So this color coded. So blue is for anterior cerebral artery, the yellow is for middle cerebral artery, and this brown is for the posterior cerebral artery. You can see this is the lateral surface or superior lateral surface, this is the medial surface, and this is the inferior surface or the base of the brain. So much of the lateral surface, so you can say it is supplied by the middle cerebral. A small strip along the superior border, it is by the anterior cerebral, whereas much of the posterior part, that is your occipital lobe, so it is by the posterior cerebral, okay. Similarly the medial surface, it is mainly by your anterior cerebral artery. So much on the posterior side, the occipital lobe part of your parietal lobe, it is by the posterior cerebral artery, where the temporal pole is by the middle cerebral, okay. So whereas this central area, you can see it here, what you find here, this is the area where you have deeper the all the fibers as well as the basal ganglia, so that is corpus striatum, it is all there, so which are which will be supplied by your the branches from the middle cerebral. So that is what I was explaining, the striate branches, what are the central branches, those branches which will be from the middle cerebral supplying the those nuclei. And this is the inferior surface, again much of it is by your the posterior cerebral artery, and even this strip is by the middle cerebral, whereas the anterior what is that frontal pole is by your the anterior cerebral artery. So this is the area of territory of these three vessels: middle, anterior, and posterior cerebral artery. So these three diagrams are very important. Maybe a line diagrams are there in some of the textbooks. You try to practice them. So to explain the areas of territories of anterior, middle, and posterior cerebral arteries. So remember those three important points which I explained from the branches from these three vessels. So they are the cortical branches, central branches, choroidal branches. So cortical branches supplying much of the cerebral cortex, central branches supplying much of the white matter, that is fibers, including your the nuclei, whereas choroidal branches much they are forming the choroid plexus within the ventricles which secretes your the CSF. So few points about these central vessels, so especially from this middle cerebral artery. So these central vessels from the middle cerebral artery which are supplying this, these what are these are the basal nuclei, right? The putamen, the globus pallidus, lentiform nucleus, the caudate nucleus, and between them you have this the internal capsule fibers. These are the important fibers. So internal capsule which have fibers, that is corona radiata, the fibers, corticonuclear fibers, corticopontine fibers, corticospinal fibers, all those fibers, descending fibers as well as ascending fibers, they run through the internal capsule. So any aneurysm or any thrombus or emboli or the block obstruction in these central branches from the middle cerebral artery will have very serious complications. So many of those fibers from all the cortex, they pass through a small area, that is internal capsule. So any obstruction in these vessels will cause infarction of this internal capsule or the infarction of this what is that corpus striatum, so that is the basal nuclei, will give rise to very serious complications. And one of these central branches we call it as the lateral striate branch, the striate branch which supplies your corpus striatum including your the internal capsule. So that is the most commonest vessel which usually goes for the cerebrovascular accident, that is in fact that is obstruction. So that's why that is also called as the Charcot's artery. What is that artery called as? The Charcot's artery. So let me show, I think it is labeled somewhere. So not shown here, ma. So okay, remember. So one of the branches, the striate branches of this middle cerebral artery is called as the Charcot's artery. Charcot's artery. So depending on the person who what is that located that vessel. So that is a Charcot's artery, which is the most commonest vessel which goes for this cerebrovascular accidents, giving rise to infarction of this basal nuclei including the what is that internal capsule. So that is artery called as the Charcot's artery. What is the Charcot's artery? It is the striate branch from the middle cerebral artery. Okay, so remember that point. So this is the picture showing you the choroidal plexus. So this is the choroidal plexus within the inferior horn of the lateral ventricle. So which is formed by your the anterior choroidal artery, which is a branch from the internal carotid artery. As I explained, the anterior choroid plexus are from the vessels of the carotid system, whereas posterior, which is the choroid artery, it is from the vertebrobasilar system, which will be forming choroid plexus in the third ventricle. Okay, yeah. The same pictures which I explained till now. Okay, so all these the what is the central branches, usually they pass through this perforated substance. That's why you have these perforated substance, anterior perforated, and this is the anterior perforated and this is the posterior perforated. Show you, yeah. So this is the anterior perforated substance, this is the posterior perforated substance. You can see here. So these central branches from the posterior cerebral as well as central branches from this middle cerebral, they all pass through this area. So that's why the area appears perforated, because of these multiple central vessels passing through these areas causing perforation. That's why these areas we call it as perforated substance. So where they go deep in the white matter including your the nuclei. Okay, So this is the posterior perforated substance, this is the anterior perforated substance pierced by these central vessels of the posterior cerebral as well as the middle cerebral arteries, including the anterior cerebral vessels. So all these three vessels, anterior, middle and posterior, so as I said, they give three sets of branches: cortical branches from the cortex side, the central branches which all they pass through these perforated substances, anterior and posterior perforated substance, and the choroidal branches which will be going to the ventricles forming choroid plexus which secretes your CSF. So I think that completes your the arterial blood supply to the brain. Okay. So what clinical aspects you could keep in mind? So as I said, 2 points. Number one is the aneurysms. In which vessel the aneurysms are common? So that is anterior communicating artery. So the congenital aneurysms are very common in that artery, that is anterior communicating artery. So even they may be found, small aneurysms may be found in these central branches. Okay. And one more point I explained is, so this is again as I was explaining, the berry aneurysm. So what I was explaining, okay, from this anterior communicating artery. So you can see this dilation of the anterior communicating artery. So forming what we call it as aneurysm. So this aneurysm is called as Berry's aneurysm. Okay, remember this one point. And one more is, yeah. So this is the CT scan images of the brain to show you the infarction as well as the bleeding. Okay. So in these two pictures, this one and this one, you can see this small white area. So they are white compared to the surrounding area. So that means what? So here is the area which is where there is bleeding. Bleeding may be because of rupture of the vessel or from the rupture of the aneurysm. So that area appears white in your CT scans. So that is a bleeding. Okay. So whereas if you observe here, so the same area what I was explaining, those central branches. So maybe an obstruction, small obstruction. So you see the area which is going undergone infarction. Okay. So this is the area which appears little darker compared to the surrounding area. So this is the area of infarction, this is the area of bleeding. These are the CT scan images of the brain to show you the cerebrovascular accident. This is the one showing you the infarction. So these are the two showing you the bleeding. As I said, the Charcot's artery is the one vessel which usually goes for what is that obstruction, giving rise to what is that infarction in the mainly in the internal capsule, that is called as the Charcot's artery. So now coming to the venous drainage. So I guess there is nothing much to be explained in this venous drainage because you already learned the dural venous sinuses. So those are the dural venous sinuses which drains venous blood from all parts of the brain, and ultimately all that blood which is present in the dural venous sinus, it passes through the internal jugular vein, so which passes through a jugular opening in the base of the skull. So jugular veins, the two jugular veins, right and left internal jugular veins, very important. So internal jugular veins, they will be draining all the venous blood from the brain through these dural venous sinuses. You already know that dural sinuses. So they are the superior sagittal sinus, then you have inferior sagittal sinus, then you have transverse sinus, then you have sigmoid sinus, and then which continues as the internal jugular vein. So then you have what is that? Some other small venous sinuses, that is superior and inferior petrosal venous sinuses. Then very importantly on the anterior side, on either side of the sphenoid bone, you have the cavernous sinus. So all these are the dural venous sinuses. So which will be draining blood from the brain through different tributaries, and even I guess you know the tributaries through which these dural venous sinuses they are receiving the blood. The very important tributaries for the superior sagittal sinus is this superior cerebral veins. Let me show you this picture. Yeah. So this is what is the superior sagittal sinus present within the dura. So which is drained by these all superficial veins. So which is one is the superior cerebral veins, multiple. Some are on the anterior side, some on the posterior side. Anterior superior cerebral vein, posterior superior cerebral vein, like that. Okay, so they all will be draining blood into the superior sagittal sinus. So one more big superficial vein is there in the lateral sulcus, that we call it as superficial middle cerebral vein, which is be draining anteriorly into the cavernous sinus. See here, so this is the superficial middle cerebral veins. Anteriorly they are draining into the cavernous sinus. So posteriorly it gives an important anastomotic channel, you can see here. So this superficial middle cerebral vein is connected to superior sagittal sinus as well as the transverse sinus through two veins, that is the superior anastomotic vein and one is the inferior anastomotic vein. I'll show you one more picture. Yeah, so which are named. So this is the superior connecting vein, so that we call it as vein of Trolage, and the inferior connecting vein which connects this superficial middle cerebral vein with the transverse sinus, that is the vein of Labe. Okay, so these two veins are named vein of Trolage and vein of Labe, which are superior and inferior anastomotic veins connecting the superficial middle cerebral vein with the superior sagittal as well as the transverse sinus. So I explained the superficial what is the superior cerebral veins, then superficial middle cerebral vein. So these are the veins on the lateral side of the what is that, the cerebral hemispheres, whereas on the medial side you have this inferior sagittal sinus on the down, that is just above the corpus callosum. The very important vein which is there on the medial side, that you find in the medial sections or the sagittal sections of the brain, is the great cerebral vein. This is the great cerebral vein which joins with this inferior sagittal sinus to form the straight sinus, which goes for your with the joining with your transverse sinus. Okay, let me show it again this picture. Yeah, so this is the important vein, that is the great cerebral vein. This is the great cerebral vein. How is this vein formed? By again multiple tributaries, that is thalamostriate veins, draining your thalamus and the corpus striatum. So on both sides, right and left. So then they join to form what we call it as internal cerebral vein. So which in turn join to form the great cerebral vein. So which is again joined by one more vein, that is called as the basal vein, which is formed from the I think it's really confusing different names. So you can see it here. This is the anterior cerebral vein which continues here as the basal vein. So the basal vein and the internal cerebral vein. So all these join to form the great cerebral vein or vein of what we call it the Galen. Okay. How is this great cerebral vein formed? By the union of the basal vein. I repeat, basal vein. Then the two internal cerebral veins. So all these join to form the great cerebral vein. So this great cerebral vein joins with the inferior sagittal sinus. Okay, forms the straight sinus, which goes to your confluence of venous sinuses. Okay, so from there drains into the dural venous sinus. Okay, so how is this internal cerebral vein formed? It is formed by your the thalamostriate veins. You can see here the thalamostriate vein, that is thalamostriate veins, and some of the choroidal veins, they join to form internal cerebral vein, both on the right side as well as left side. So these two internal cerebral veins as well as two basal veins, right as well as left. What are those basal veins? They are from anterior cerebral veins. All those veins, they join, the two internal cerebral, the two basal veins, they join to form one bigger vein, that is the great cerebral vein or vein of Galen, we say. So which joins with the inferior sagittal sinus to form the straight sinus. Okay, you know, already studied the straight sinus along with the dural venous sinus. So that's about the venous drainage of the brain. So it is the venous supply of the venous drainage of the brain through your dural venous sinuses, ultimately draining into the internal jugular veins, then to your brachiocephalic veins. And even you have, you know, already that these dural venous sinus are communicated with the what is that, extracranial venous sinus, extracranial veins through your the emissary veins, so that there is communication. Because of this communication, and as these veins are valveless, so there may be spread of infection from outside the cranial cavity to the into the cranial cavity through these emissary veins. Okay, so those parts you already studied, I guess. So I think that completes the blood supply of the brain. So what are the clinical aspects I explained? I explained about the stroke, maybe from infarction or bleeding, or from even rupture of your the aneurysms. So where are the aneurysms common? Aneurysms are very common in the anterior communicating RC, connecting your two anterior cerebral arteries. So what is the Charcot's artery? It is one of the central branches of your the middle cerebral artery, the striate artery, the lateral striate artery, which is supplying your the corpus striatum as well as the internal capsule, which usually goes for obstruction causing damage to the basal ganglia as well as internal capsule. This is the commonest vessel which is involved in the cerebrovascular accident. So that is called as the Charcot's artery. Okay. So that's all about the blood supply of the brain. So that completes my class. So as I said, I think this will be my last class to you. So let me wish you all the best for your upcoming exams. I don't know when the colleges will start. Let's hope they open soon. And you may, what is that? Find some time to come and do dissection, see the specimens of the brain, so that we'll be understanding the neuroanatomy better. So let's hope for it. So anyhow, all the best. Thank you.